All right, so today we're going to take a deep dive into something that, as a nurse, I know you're going to find really interesting.
Okay.
Client-centered therapy.
Okay.
And we're going to look at some really fascinating research articles, um, even personal reflections from therapists to understand how this approach can really change the way you connect with and care for your patients.
Yeah, it's such a powerful approach.
Yeah,
And I think what's so interesting is that it's not just a set of techniques.
right.
It's a whole philosophy of care that's
Yes,
really built on a deep respect for the individual.
exactly. And I think that's what makes it so relevant for nurses, right?
Yeah,
Because you're already dealing with people at their most vulnerable,
right.
their anxieties, their hopes, all of that.
Yeah.
So how do we create that space where they feel truly seen and heard and empowered?
Well, at its core, client-centered therapy is about recognizing and honoring the inherent capacity that each person has for growth and self-direction,
Hmm.
even when they're facing illness or trauma or just the everyday challenges of life.
Yeah, that's so different from the fix-it mentality we sometimes see in healthcare, right?
Absolutely.
Yeah,
It's not about the therapist, or in your case, the nurses having all the answers.
right.
It's about being a facilitator for that process of self-discovery,
Yeah,
being a compassionate guide and not a director.
I love that. I love that. And one of the sources I was reading described the therapist as an alter ego for the client,
Uh-huh.
like a mirror reflecting back their true self.
Yeah.
That really resonated with me.
It's a beautiful analogy. It
Mhm.
really gets at the heart of the therapist's role
Mm.
to create a safe, judgment-free space
Okay.
where the client can really explore their own inner world, their
Yeah.
feelings, their
Mhm.
experiences without fear of criticism.
Okay, but how does that actually work in practice?
Right.
I mean, nurses are busy, we've got procedures and medications and families to deal with.
Yeah.
How do we create that kind of space in the midst of all of that?
It starts with your attitude.
Okay.
Um, it's about genuinely believing in your patient's ability to heal, to grow, to make choices that are right for them.
Hmm.
And that belief needs to be communicated not just through words, but through your presence,
Yeah.
your listening, your non-judgmental acceptance.
There was this quote that really stuck with me, and it said, "To be of assistance to you, I will put aside myself and enter into your world of perception as completely as I am able."
Wow.
It's like stepping into their shoes, seeing the world through their eyes,
Yeah.
even if their perspective is different from your own.
That's what empathy is all about. And
Yeah.
it's crucial in client-centered therapy. It's
Mhm.
not about agreeing with everything the client says or does,
Right.
but it's about trying to understand where they're coming from, what their experience is like.
So it's not just about being nice. It's about a deeper level of understanding.
Exactly. It's about truly listening, not just to the words, but to the emotions behind them,
Right.
and reflecting back that understanding so that they feel heard and validated.
One of the therapists talked about adopting the client's frame of reference.
Yeah.
Can you unpack that a bit more for us?
Sure. It means really trying to see the world through their lens,
Okay.
acknowledging their unique experiences, their beliefs and values,
Right.
even if they differ from your own.
Right.
It's about putting aside your own biases and judgments and meeting them where they are.
The source material had some really powerful case studies that I thought brought this to life.
Yeah.
There was one about a young woman who was struggling with chronic pain,
Uh-huh.
and she felt like no one believed her,
Wow.
not even her doctors.
That sense of being dismissed or invalidated can be incredibly isolating and disempowering.
Absolutely. And in this case, the therapist, by simply listening with empathy and acknowledging her pain, helped her feel seen and heard for the first time.
Mm-hmm.
And that validation alone can be incredibly healing.
Yeah.
It creates a foundation of trust
Right.
and allows the client to start exploring their feelings and experiences more openly.
Yeah.
It seems like it takes a lot of self-awareness on the part of the therapist to be able to truly put aside their own judgments and biases,
Yeah.
especially when dealing with patients who might be challenging.
Absolutely right. And that's why training in client-centered therapy really emphasizes the therapist's own personal growth and self-discovery as a foundation for their work with clients.
So it's not just about learning techniques, it's about developing a certain way of being.
Precisely. It's about cultivating those qualities of empathy, genuineness, and unconditional positive regard for the client.
Right.
Even when they're struggling, even when they make choices that we might not agree with.
That sounds challenging,
Yeah.
especially in a fast-paced environment like a hospital,
Right.
where nurses are often under pressure to get things done quickly.
It is challenging,
I
but it's
know.
also incredibly rewarding. And
Yeah.
even small shifts in your attitude and the way you listen and respond
Yeah.
can have a profound impact on your patients.
I'm thinking about how this applies to difficult situations, like when a patient is refusing treatment
Right.
or making choices that seem harmful to their health.
Yeah.
How do you balance respecting their autonomy with your responsibility to provide care?
That's where the power of self-direction comes in.
Okay.
It's not about forcing our own beliefs or values onto the patient,
Mm-hmm.
but about helping them explore their own motivations and make choices that are aligned with their own goals and values.
So even when we disagree with their choices, we can still respect their right to make those choices.
Exactly. And by creating a safe space for them to express their concerns, their fears, their hopes,
Mm-hmm.
we can help them make more informed and empowered choices.
There was a case study in the source material about a man who was struggling with addiction,
Okay.
and he kept relapsing despite repeated attempts at treatment.
Addiction is a really complex issue,
Yeah.
and it often involves deeply ingrained patterns of behavior and coping mechanisms.
And in this case, the therapist didn't judge or shame him for his relapses.
Right.
Instead, she helped him understand the underlying reasons behind his addiction, his triggers, his vulnerabilities.
That kind of understanding can be incredibly empowering for someone who's struggling with addiction.
Yeah,
It allows them to see that behavior not as a moral failing,
right.
but as a symptom of deeper issues that need to be addressed.
And in this case, by exploring those deeper issues, the man was eventually able to make lasting changes and break free from his addiction.
Wow, that's great.
It's a great example of how client-centered therapy can help people overcome even the most challenging obstacles
Yeah.
by tapping into their own inner resources and their capacity for growth.
Absolutely.
It's fascinating how this approach doesn't shy away from exploring difficult emotions and experiences.
Right.
In fact, it seems to embrace them as opportunities for growth and self-discovery.
That's right. It's about creating a space where all feelings are welcome,
Yeah.
where nothing is judged or dismissed.
Mm-hmm.
And within that safe space, clients can start to unravel the knots of their own pain, their own confusion, and find their own way forward.
It's like creating fertile ground for healing to occur organically from within.
Exactly. And that healing process often involves examining deeply held beliefs and values, some of which may be hindering their growth or well-being.
You're talking about those introjected beliefs we mentioned earlier.
Yes, those beliefs that we've internalized from our families, our culture, our society that may no longer serve us or may even be harmful.
It's like those patients who say, I'm just bad with needles, or I'm not the type of person who exercises.
Right.
They've internalized these beliefs that limit their possibility.
And those beliefs can have a real impact on their health and well-being.
Yeah.
They might avoid necessary medical procedures or struggle to make lifestyle changes because of these limiting beliefs.
So how does client-centered therapy help people challenge these introjected beliefs?
It's a gentle process.
Okay.
It's not about forcing people to change their minds,
Right.
but it's about inviting them to explore those beliefs with curiosity and compassion.
So instead of saying, you shouldn't be afraid of needles,
Right.
you'd ask, what experiences have shaped your feelings about needles?
Exactly. By understanding the origins of those beliefs,
Hmm.
the client can start to see them in a new light, to question their validity, and to consider alternative perspectives.
There's a really interesting example in the material about a nurse who was struggling with self-doubt
Uh-huh.
and feeling like an imposter in her job.
Oh, wow.
He had this deep-seated belief that she wasn't good enough, that she was going to be found out as a fraud.
It's incredibly common, especially in high-pressure professions like nursing.
Yeah.
Those introjected beliefs can really hold people back from reaching their full potential.
And in this case, the therapist helped her trace those beliefs back to her childhood,
Mm-hmm.
to experiences where she had been criticized or told she wasn't capable.
By understanding where those beliefs came from,
Yeah.
she could start to see them as echoes of the past, not necessarily reflections of her current reality.
And that allowed her to start challenging those beliefs and to build a more positive and realistic self-image.
It's amazing how powerful it can be to simply bring those unconscious beliefs to the surface, to shine a light on them.
Yeah.
Often just acknowledging them is enough to start loosening their blip.
This all ties back to the idea of self-direction, doesn't it?
Yeah.
The client ultimately has the power to choose what they believe, how they want to live their life.
Absolutely. The therapist isn't there to tell them what to do,
Right.
but to support them in making their own choices that are aligned with their own values and aspirations.
The material had this great quote about how It is as he is willing for death to be the choice that life is chosen for neuroticism to be the choice that a healthy normality is chosen.
That's such a powerful statement.
It is.
It highlights that paradoxical nature of true freedom.
Yes.
It's only when we have the freedom to choose the wrong path
Right.
that we can truly choose the right one.
So even if we see a patient making choices that we think are harmful,
Yeah.
we need to trust that they have the capacity to make different choices to change their path when they're ready.
Exactly. Our role is to support them in that process, not to try to control it.
Hmm.
And sometimes respecting their autonomy means allowing them to make mistakes, to
Yeah.
learn from their own experiences.
One of the things that struck me about the source material is that even though client-centered therapy is non-directive,
Right,
it's not passive.
right.
The therapist is actively engaged, present, attuned to the client's experience.
That's a really important point.
Yeah.
It's not about sitting back and just letting the client talk.
Right.
It's about creating a deeply empathic and responsive presence.
Can you give me a concrete example of what that looks like in practice?
Sure. Imagine a patient who's expressing anxiety about an upcoming surgery.
Okay.
A client-centered approach would involve not only listening attentively to their fears, but also reflecting back those feelings.
Mm-hmm.
You might say something like, "It sounds like you're feeling really anxious about the surgery.
Right.
What are some of your biggest concerns?"
So it's about acknowledging their feelings, validating their experience, and then inviting them to explore those feelings further.
Exactly. And as they talk, you're paying close attention not only to their words,
Yeah.
but also to their body language, their tone of voice, all those subtle cues that can reveal their deeper emotional state.
It sounds like it takes a lot of skill and practice to become really good at this.
It does,
Yeah.
but it's a skill that can be learned and refined over time.
Mm-hmm.
And the more you practice it, the more natural and intuitive it becomes.
One of the sources talked about the importance of congruence in the therapist's attitude.
Yes.
What does that mean exactly?
It means being genuine, authentic, being yourself in the therapeutic relationship.
Okay.
It's about being present with the client without putting on a facade or trying to be someone you're not.
So it's okay to be yourself, to let your personality shine through, as long as you're still grounded in empathy and respect for the client.
Exactly. In fact, that genuineness is what allows for a truly authentic connection to form.
Hmm.
When the client senses that you're being real with them,
Yeah.
they're more likely to open up and share their own authentic selves.
I'm thinking about how this applies to play therapy,
Okay.
which is another aspect of client-centered therapy that I found really fascinating.
Play therapy is such a wonderful example of how these principles can be adapted to work with children who often communicate and process their experiences through play.
One of the therapists described play therapy as a safe and protected space where children can express themselves freely without fear of judgment.
And within that safe space, they can start to work through their fears and anxieties, their traumas,
Mm.
often without even realizing they're doing therapy.
There was a really touching example in the material about a little boy who was using toy soldiers to act out scenes of his parents fighting.
It's amazing how children can use play to express complex emotions and experiences that they might not have the words for yet.
And in this case, the therapist didn't try to interpret the play or tell the boy what it meant.
Right.
She simply provided a safe and accepting space for him to express himself.
And that in itself can be incredibly therapeutic.
Yeah.
Just having someone who listens without judgment, who reflects back their feelings, can help children feel seen, heard, and understood.
I can see how play therapy could be really valuable in a nursing context,
Yeah,
especially when working with pediatric patients who might be scared or anxious about being in the hospital.
absolutely. By incorporating play into your interactions with children, you can create a more relaxed and comfortable environment, build rapport, and help them cope with the stress of hospitalization.
So instead of just focusing on medical procedures and tasks,
Right.
you're taking the time to connect with them on their level through their language of play.
Exactly. And you might be surprised at how much they reveal through their play, their fears, their anxieties, their hopes.
Yeah.
It can be a really powerful tool for understanding and supporting their emotional well-being.
It seems like client-centered therapy, whether applied to adults or children, really challenges traditional power dynamics in healthcare.
Yeah.
It's not about the expert dictating the solution,
Right.
but about empowering the individual to find their own path.
That's a key insight. It's about shifting from a model of fixing
Right.
to a model of facilitating, from a focus on disease to a focus on the whole person.
The source material also touched on some of the research that's been done on client-centered therapy.
Mm-hmm.
And it's not always easy to measure the effectiveness of this
All
approach,
right.
but some studies have shown some promising results.
Yeah, one study looked at the language that clients use throughout therapy
Okay.
and found a shift from talking about symptoms to talking about themselves.
That's interesting. It suggests a movement towards greater self-awareness and self-acceptance.
There was also a trend towards expressing more positive feelings about themselves as therapy progressed.
And a decrease in defensive behaviors.
Exactly. These findings suggest that client-centered therapy can help people become more self-aware,
Hmm.
more accepting of themselves, and more open to exploring their own experiences.
And those things can have a ripple effect on their lives, their
Absolutely.
relationships, their overall well-being.
When we feel better about ourselves, we're more likely to make healthier choices,
Right.
to engage in positive relationships, and to contribute more fully to the world around us.
As we're exploring all these different aspects of client-centered therapy, I'm realizing how relevant this approach is, not just to therapy, but to life in general.
That's so true.
It's about how we connect with others,
Yeah.
how we listen, how we create a space for genuine sharing and growth.
These principles can be applied in any relationship,
hmm
whether it's with your patients, your colleagues, your family, or your friends.
It's about bringing that same attitude of empathy, respect, and genuineness to all our interactions.
And when we do that, we create a more compassionate, more connected, and ultimately more fulfilling world for everyone.
This deep dive has really made me think about how I can bring these principles into my own nursing practice.
Yeah.
I'm already imagining how even small shifts in my approach could make a big difference.
And that brings us to the question of how therapists are trained in this approach.
Okay?
It's fascinating how the emphasis has shifted over time. In
Mm.
the early days, there was more focus on specific techniques,
But now,
but now the focus is more on the therapist's overall attitude and philosophy.
Mm.
It's about cultivating that deep sense of empathy,
right.
that unwavering belief in the client's capacity for growth.
In one of the sources, a therapist described it as a shift from counselor technique
Yeah.
to counselor attitude and philosophy.
Mm-hmm.
And I feel like that really captures the essence of what we've been talking about.
It does.
It's not just about what you do,
Right.
but about who you are as a caregiver.
Exactly. It's about embodying those qualities of empathy, genuineness, and unconditional positive regard in every interaction.
And that's something that can't be taught through textbooks or lectures alone. It
Right.
requires a deeper level of self-awareness and personal growth.
Absolutely. So aspiring therapists, they actually develop that kind of presence by training programs, placing a lot of emphasis on experiential learning.
Oh, interesting.
So it's not just about reading books and attending lectures.
Right.
They actually have students role play as both client and therapist.
Wow, I can see how that would be really powerful to actually experience both sides of the therapeutic relationship.
Exactly. It helps them develop empathy to understand the nuances of the client-centered approach and to identify their own strengths and weaknesses as therapists.
Some programs even use recordings of real therapy sessions,
Yeah,
so students can analyze the interactions and learn from experienced practitioners.
that kind of feedback and reflection is crucial for growth.
Yeah.
And then there's the practice of having students counsel each other under supervision.
It sounds like they're creating a really safe and supportive environment to try out these skills
Yeah,
and get constructive feedback before working with actual clients.
precisely. And through this process of experiential learning, self-reflection, and feedback, therapists can really start to embody those core principles of empathy, genuineness, and respect.
It's not just about learning technique, it's about becoming a certain kind of person.
Exactly. It's about developing a way of being that allows for genuine connection and healing to occur.
As we wrap up this deep dive into client-centered therapy,
Yeah.
I'm struck by how much it has to offer nurses.
Right.
It's not just a therapeutic approach.
Mm-hmm.
It's a philosophy of care
Right.
that can really transform the way we interact with our patients.
I completely agree. By embracing these principles of empathy, respect for autonomy, and belief in the individual's capacity for growth, we can create a more compassionate, patient-centered, and ultimately more effective healthcare experience.
So as you continue on your journey as a nurse, I encourage you to reflect on what we've discussed today.
Yeah.
How can you bring more of that client-centered approach into your own practice?
How can you cultivate that deeper level of listening, that genuine curiosity, that unwavering belief in your patient's ability to heal and thrive?
Even small shifts in your attitude and approach can make a world of difference.
Remember, you have the power to create a space where your patients feel truly seen, heard, and empowered to take an active role in their own healing journey.
That's it for this deep dive into client-centered therapy. Until next time, keep learning, keep growing, and keep diving deep.